This is Eye on Health
delving into your overall well-being
with MedLab Middle East
on Dubai Eye 103.8.
Great to have you with us. I'm Helen Farmer. You are listening to Eye on Health here on Dubai Eye 103.8, brought to you by MedLab Middle East and Arab Health. Today, we are talking about COVID. Is it here to stay? With regular vaccines mandatory and, well, what about that new variant? What do we need to know? We're finding out from the experts. And first in the hot seat is Dr. Sharma, a specialist in internal medicine at the Saudi German hospital here in Dubai, which was really integral when it came to identifying and treatment of COVID at the height of the pandemic. Dr. Sharma, thank you for making time for us today. I really, really appreciate it. How are you? And Happy New Year.
Thank you. And same for you and your family.
Thank you. It's strange, isn't it? Because I think we thought that we just stopped talking about COVID by 2023, but it's still not even rumbles on, it's roaring on in some countries, in some areas. China, we're seeing 1 million cases a day. We're seeing rising cases of a new variant in the US in particular. And I just wondered if you were able to give us a bit of a read on, aside from the headlines in the media, what's happening here in Dubai?
Say, Dubai government followed, or UAE government as a whole, the standard guidelines which have been periodically released from the WHO. So here the almost 100% people are fully vaccinated by a proper FDA approved vaccine, and almost 95 to 98% have received a booster dose as well. So it's a fairly protected population in UAE, which may not be the prototype globally.
It definitely isn't. It definitely isn't. I think a lot of countries will perhaps look back and think, what if, should we have done? And I think the UAE has got a lot to be proud of in terms of the agility and how fast we were able to move.
I must compliment the leadership for taking a pioneering role in this direction and in a very timely fashion.
Absolutely. So as you say, we've got a very well protected society. We've got also, I would say, quite a compliant society here in the UAE. And I know a couple of people with COVID now, a couple. Whereas, you remember what it was like 18 months, 2 years ago. It would be whole schools and neighbourhoods. But as I said, in other parts of the world, that tragically is the case again. So why do you think that might be in other parts of the world? And let's look at China in particular.
Yes. I will tell you, say, when this is a pandemic, it is affecting the whole globe. So that means all the preventive measures should be uniformly followed globally. Unfortunately, certain countries, especially the ones that you were mentioning, they followed their own guidelines. Very small number of people were vaccinated in China, and that too by a locally made vaccine whose authenticity and efficacy is very much in doubt. And they put the absolute clamp down. So it was like a double whammy. The society was not exposed to the COVID virus, so they could not get the herd immunity. And number two, they could not get the proper vaccination by adequately tried and tested, authenticated, efficacious vaccine. So with the result, what is happening, and now suddenly they have opened up. Now, once you open up, so it is virtually a deluge. Like the patients are every day, it is difficult to get the exact figure. So we cannot, because the global authorities like WHO and all are not satisfied with the kind of information they are getting. But considering the coverage in the newspapers and
it's high.
It's very, very high. I was told by a couple of my students who are studying in China now, the medical students. So there the hospitals are all full. There are no beds. So if that is any indication, that means it's like a volcano.
I think that's a really interesting point about it being a double whammy, because in some ways life has returned to normal. And we've seen this in other parts of the world as well, but our immunity hasn't returned to normal. We've been, as we should have done, been wearing masks and washing hands and practicing social distancing. But as soon as that kind of the go-ahead is given, you've got people, again, commuting close together, working close together, socialising, as people have so desired. But our immune system have definitely, It's taken a bit of a hit over the last couple of years, which is why I think we've seen a lot of flu cases this year. I remember back in 2020 speaking to a doctor who said we've had 4 flu cases coming into the clinic. There's just been none. And now, certainly in the UK, an enormous spike of influenza. Yes. So I wanted to talk to you a little bit about that new variant, because I know you very much keep your finger on the pulse. And is it XBB?
Yes,
That's what I'm hearing.
Yes, I'll come to it. See, just to clarify the audience that is coming to you, say the first strain which came was labeled as a Wuhan strain, from where it originated. But all the viruses, when they divide, they replicate, and some variants are formed. Now, all variants may not be dangerous, so WHO has given a word VOC, the variants of concern. Okay. So the first variant of concern, based on the Greek alphabet, was labeled as Alpha, which was there somewhere in UK to begin with, and then it spread. After that, the next variant came was Beta, which was in South African side. Then came Gamma, which was not very prevalent, and then came Alpha, which was starting in India and then spread globally. And the latest is Omicron. So now Omicron is the latest variant, which is all over. Now in each variant, then there are some sub-variant. So like it started with BA4, BA5, they are all Omicron sub-variant. So now latest Omicron sub-variant is XBB, and that is going to be the most prevalent form as predicted by the American literature. But we don't know much about what is happening in China, because they have not provided, in fact, before coming for a talk here, I just Googled and found out the WHO site. So they are still asking more data before they actually know which variant is being more common in China.
So, and in the US as well, and what do we know about, I guess, symptoms between those different VOCs? Yes. How do they differ in terms of, I guess, the patient experience?
Yes. Say the picture of 3-4 what we call as a respiratory viruses, the common ones like respiratory syncytial virus, influenza virus, and COVID. If we take all the 3 together, lump up them, they all manifest primarily, vast majority of them, as upper respiratory infection like sneezing, nose block, nasal discharge, cough, throat pain. Now, initial Wuhan and Alpha variant, which I've discussed earlier, they had a unique thing that vast majority of the patient had a loss of smell and loss of taste, which made them different clinically. When you are sitting in a clinic, that if somebody is complaining of these symptoms, we will think more in terms of COVID. But somehow that distinction is now gradually in the later variants not that clear.
And I think that's been very confusing for a lot of people who've been like, I've been feeling run down, I've been having COVID symptoms, but I can still taste, I can still smell. So it's probably not COVID, but that really was COVID from a time ago.
So right now in our own experience in Dubai, it's a very mixed picture. So like it is at best my word against your word. So best thing is, if you happen to come a case of upper respiratory infection, take the swabs, and immediately within 6 hours now point of care testings are available and PCR, so we are able to know which particular thing we are dealing with.
Is PCR still the gold standard of testing?
Yes, absolutely. PCR is the gold standard for not only for the purpose of diagnosis, also for epidemiological purpose, as well as for getting the medication, as far as deciding the vaccine policy. However, there are point of care tests available, like a swab test, you can do it at home, but subsequently it has to be confirmed. Yes. Because as per the case definition of WHO, you have to be a PCR positive before you are labeled as a confirmed COVID. I'll take 1 minute more just to explain. There are 3 categories how we say. One is a confirmed COVID, another is a COVID suspect, and third is a probable COVID. So suspect COVID is the one who has been exposed to the person who is suffering from COVID for more than 15 minutes of contact. And the probable COVID is that the symptoms are suggestive, but the PCR is negative.
Yes.
So that is how we categorize. But for epidemiological purpose, for numbering, it is the PCR which is mandatory.
So I wanted to ask you a little bit about vaccines then, because I always need to check my Al Hosn app because I can't remember when my last vaccine was. How do you feel like that's going to evolve over the coming years in terms of responding to new variants of COVID-19?
Yes. So, as you all know, like flu vaccine, every year a new lot comes in the month of end of August or beginning of September, based on the experience of the scientists about the mutations which are happening, and then they come out with a new lot. This is my view that in the long run, we have to live with COVID. COVID is not going, but we have to live with it, just like we are living with a flu virus. So the vaccine will also need to be modified as the virus evolves. Now already in US, the most sort of a commonly the Pfizer vaccine, the mRNA-based technology vaccine, is already the bivalent form has been already launched. And as for the US guidelines, everybody after 6 months of the booster dose of the monovalent vaccine should take the bivalent vaccine. However, in the UAE, the guidelines are still that you should have 2 mRNA vaccine doses and then one booster dose. And till date, I think it's working. But this field is very rapidly changing. So the moment we come to know something new as far as local guidelines are concerned, we'll make you aware. But as of now, the bivalent vaccine is available in US and which is being given.
So I kind of want to ask a personal question then. What would you advise your family when it comes to vaccines moving forward? Would you, you've obviously got to follow the country guidelines, but what would be your gold standard of protection?
Say my gold standard will be that if you find that there is a sudden spurt of more COVID cases, then messenger RNA-based bivalent vaccine will become order of the day, if not now, maybe in times to come. And if not for everybody, at least for those people who are more prone.
Yeah, the at-risk categories.
So which we call them as a high-risk individuals. So they include like elderly people, very young people, people with immunocompromised state, like they are on some cancer chemotherapy, or they are on radiotherapy, or they are on some immunomodulators for joint diseases and other things, or they are on dialysis, heart failure patients, patients of asthma and bronchitis. So there is a defined criteria. So at least these people can be offered a bivalent vaccine, if not for everybody.
I think it's been also quite interesting to see how long COVID has evolved over the last couple of years, and for a long time, the analogy was being used like we're trying to fly the plane while fixing the plane at the same time. And long COVID, I just saw a friend at Christmas who is still nearly 3 years on, really struggling. Same age as me. Mum of young kids, pretty fit before, and now struggles with respiratory problems, climbing up the stairs, low energy, that very kind of post-viral fatigue type symptoms. She's taken herself to a clinic in Cyprus, I believe, where they were spitting blood for, microclots and injecting it back in, and she's felt no effect. And I wondered if you had any kind of predictions or hopes when it comes to the treatment of long COVID in this year or the coming years.
In fact, what you're talking is a very relevant point, and a common man is not very much aware of this. That post-COVID syndrome is a known entity. But now anybody who is having any symptom does not fit into a post-COVID syndrome. So what happened in a small subset of people, say you must understand what happens. When you get an infection, our own body also reacts against that. Our own immunity reacts just to eliminate the virus by many mechanisms. So what happens in a small subset of people, this immune response, the natural protective response, is little hyper, little more as compared to a general population. So the most of the COVID syndrome patients, what you are talking about, are the ones which have exaggerated immune response, and as a result of that, certain long-lasting tissue inflammations, especially in the lung, some blood clotting disorders have developed. And on top of this, of course, some neuropsychiatric symptoms. Partly it could be medical and partly it could be circumstantial
Absolutely.
and social as well.
We saw a lot of hair loss, for example,
because
after COVID.
some people have a hair loss, and there is a lot of panic. People are afraid.
Menstrual cycle disruption.
Yes, exactly. So all these things together, what we call them, are leading to a part of it have a psychosomatic component as well. But it is a definite entity. And if any patient comes to us with a post-COVID syndrome in our hospital, there is a fixed protocol that he has to undergo these tests.
I want to know what that is. What do you tend to advise for anyone listening today who still might be feeling a little off post-COVID? What's on your protocol at Saudi German?
Say the protocol includes that first of all we do some blood test to see the degree of inflammation by doing like your blood counts, like your C-reactive protein. For checking the clotting factors and all, we advise a test which is known as a D-dimer, because if the D-dimer is increased, that means the immune response is leading to more clotting tendencies, and especially in young females who are on some hormonal pills, contraceptive pills, they are more prone, or some people who have got some other blood disorders. So these are the tests, especially the asthmatics. So they can have, so we are advising chest x-ray, we are advising pulmonary function test, because our stethoscope may not reveal anything. But when we do for the cardiology, my stethoscope may not reveal. But when we do the electrocardiogram and other tests, we find the disease. In the same way for lungs, stethoscope and x-ray may not be sufficient enough. So we do the pulmonary function test, the DLCO, so that if there is any chronic problem going to come up, we can pick it up in time and fix it.
Thank you so much for your time today. Perfect timing, really, I think, given, unfortunately, a level of panic that's happening around the world. When it comes to travel restrictions, we're seeing various countries demanding now negative tests. Where do you see that going, is my last question to you? I guess your predictions for 2023 and COVID-19.
Say, my own guess is that by and large, globally, the world has fallen in line with the latest recommendations, barring a little bit of Southeast or East Asia, China and these countries. And it is almost 1/5 of the population lives there. So that is a little area of concern. Other than that, I think in a well-protected society and with the precautions that are already in place, I think there should not be any panic or anything. But we have to be little careful. That's the only thing.
And I think that's exactly it. I think that's what I've taken from this now. If I'm not feeling well, wear a mask, wash hands, be sensible, be considerate.
Yes, we have to be little careful, and especially the elderly people and the people who are like the high-risk people which we discussed. Other than that, if you are not going to the area
spots
where right now the disease is more prevalent and somehow we are able to contain that maybe next few months, then I think we will have a very bright future ahead.
That's a perfect note to end our chat with, Dr. Sharma. Thank you so much. Really, really appreciate your time speaking to us from the Saudi German Hospital Specialist in Internal Medicine. Wishing you and all the team there at the hospital and the family too very happy and, most importantly, healthy 2023.
Thank you very much, and giving us the time to share my views on this subject. Thank you very much.
Up next, we're going to be discussing the difference between COVID and flu, especially as so many of those symptoms are similar. And how can we protect ourselves from both? Dr. Hisham Ali, an ICU specialist at NMC Provita in Abu Dhabi, will be on hand to advise.
Eye on Health
With MedLab Middle East.
on Dubai Eye 103.8.